Well, concern being raised over the state of emergency care in Alberta, the lengthy wait times people are facing in ERs, and the fact that many are just giving up and leaving. The head of emergency medicine for the Alberta Medical Association calling attention to this and even calling on the Premier herself to come witness this firsthand, maybe spend some time on shift. Dr. Warren Thirsk is with us on the program. Dr. Thirsk, good to have you with us here.
Thank you for having me.
Kind of give us an overview, first of all, of what we're seeing. I know it does vary from region to region, hospital to hospital, but we are seeing increased wait times. There's this concern that we're seeing people, give up and leave. What's kind of the overview right now, first of all?
I think the overview of one is just overwhelmed healthcare system, right? On all fronts. Everywhere you see a queue or a wait time, there is a lack of what we need to look after the person who needs it. So it really is a system-wide issue at this point. And an emergency is just where I see it.
What are the factors, though, that are causing this?
Well, there's too many to quickly describe. I think that the best way to say it is this is a multiple decades long decision to trim services until the backlogs are evident in the people that we care about, the Albertans who need healthcare.
I mean, we got a growing population, so I mean that's part of the challenge we're facing. But we've got concern over measles. That's a pressure point on the system right now. Are we seeing other factors in that sense?
I think that measles is a great example of a healthcare system that is not meeting the needs of Albertans for a variety of reasons. And then measles is the result. Measles is just a virus trying to do what viruses do, spread to people and have its own existence. And as a healthcare system, we would do our best to prevent people from suffering measles because measles is bad for people. It hurts people. And that's its role as a virus in our lives.
Yeah. It's one thing to see the numbers on paper, to see the wait times or see survey results, but to see it in person and talk about then why you've urged the Premier then to maybe come and spend some time on shift and see it for herself.
Well, we currently seem to have a very top-down healthcare system. So everything comes from the top and it doesn't seem to trickle down to those of us on the front line. And I think that people who manage numbers and that this is their existence fail to see the person behind the number. It's easy to make decisions with numbers because you can create a false sense of control and an artificial sense of reality. So a wait time is a good example. It's an average wait time that we are looking at. You can go online and find it, and it changes minute by minute. And you think that you have control. Oh, I'm going to choose my wait time. I'm going to go to this hospital and pick 2 hours or 5 hours or, whatever. So it gives us artificial control. So I would say, okay, let's go to that hospital with a wait time. Let's make it 2 hours. Let's make it simple, 2 hours. Let's say there's 30 people in that waiting room, which is, depending on the hospital, a small number. 2 hours means that 50%, half, 15 people will wait longer than 2 hours. That's what that number means. Half will wait less than 2 hours, but not zero. And so we are taking someone who is in pain, who is suffering, who is vomiting, who has uncontrollable diarrhea, who has something really bad for their unplanned medical event, because you didn't schedule this and you certainly didn't go looking for it. And so now we're making them wait before they even see anyone, before they get any help, any care. And so behind those numbers are 30 people with various amounts of suffering. As the physician on the front line who sees them, I will see each one of those people. And then they will be upset. The one who waited 4 hours while vomiting can look at me in the eyes and say, why did I wait so long? And I have no answer as an individual physician. Right. I do my best to gain an alliance, but that's all I can do. I do my best to treat them once I get to them. That's all I can do. They're grateful and they don't complain. Albertans need to find their voices and start actually complaining about these wait times.
Right. I mean, 2 hours almost seems on the low end in some circumstances. In the big cities, we've seen wait times approaching into the double digits. And not just the time people are waiting, but the circumstances, right? Waiting rooms that are overflowing, right? Patients basically sitting in hallways.
Sitting in ambulance stretchers on hallways, sitting in stretchers on hallways with no care, with no limited access to bathroom facilities, no one providing water, food, things that we would consider unacceptable. When smaller wait times happened in the airline industry, there was a massive push for accountability and change. We have a new federal agency telling us how it's going to go. And yet Albertans will put up with worse wait times for worse conditions. I mean, an airline plane flight is potentially deferrable. Yes, you're upset you didn't get to see your family. Yes, you're upset you missed your vacation. You have lots of reasons to be upset, but you're not potentially dying. You're not in pain. Your limbs aren't fractured. You're not bleeding. You're not vomiting. Like, it's a different world, and yet we accept so much less in the circumstance because we're so grateful for the care we get. And I think all frontline workers, in fairness, do a great job. We do a great job of mollifying this and making this better for the person at the time so that it suddenly becomes acceptable. And I think the numbers have made it acceptable. We talk about numbers, not the suffering. And that's what I would like the Premier and anyone who deals with numbers to come and actually see those numbers. That's the difference.
And to see that suffering, to see people waiting and agonizing and just feeling it as physicians, like you're just kind of drowning in all of this. Like you want to help, you can't, right? There's nothing you can do. What kind of pressure does that put on those who are trying to deal with all of this?
It's haunting. As I've said before, it's haunting. It's soul wrenching to be a helper and not be able to help everyone in front of you, to be overwhelmed with the numbers of people coming at you. There's been decades of cuts. So going back to the 90s, there was the Bear Stoddard report, which under poor number assumptions was a model of how many physicians we would need. And so we cut medical schools, we cut physicians, we've cut nurses. Everything was cut with the idea that people wouldn't need it. And that's the thing about healthcare and why the emergency department is the window into the real problems is, you don't need healthcare until you need it. Yeah. It's guaranteed. Most of us as humans will need it someday, myself included. And so we don't want to provide for something we're not using today. And we don't want to plan for tomorrow necessarily. And we certainly don't want to pay for tomorrow. And we certainly have lost maybe the Canadian sense that we should be looking out for each other and paying for other people. So I'm not necessarily providing for your health emergency. I don't know you well enough, Rob, to know what it would be. But, you're a human. So at some point, something will happen, just like something will happen to me. Something's happening to my parents right now. Something's happening to my aunt and uncle. So all of us have family members. All of us will know someone who needs healthcare. And so the question is, do you want someone there, or how long do you think the wait should be for that healthcare? When it's your family member, most of us think that the waits are unacceptable. Most of us think that it's under-resourced.
One of the consequences we saw confirmed in this survey from the AMA is that people leave, people give up, people go home. They just can't bear the wait, which is worrying because those conditions don't go away. And does that lead to something worse down the road? What are the consequences of that?
Well, I mean, the unknown is the unknown. So we don't know because those people don't register the next day. Many of them register the next day. Like the number of people who say, I tried yesterday and I gave up. I went home for some sleep. I hoped it went away, but it didn't. So I'm back. All right. So we see those people come back, but they don't get connected to that first number. So they're not connected. And like they tell me anecdotally what they've done, but they don't register in the numbers. So the number of people don't see those folks, right? Once they go, it's almost like the people who control the numbers, the folks who make decisions want to believe that it's not a problem, right? Or they didn't need the emergency department. There was an interesting call-in on the CBC radio yesterday that I took, that I got to listen to. And a call-in person named Scott shared his daughter's story. And they went to a hospital in Edmonton. His daughter had an allergic reaction in her scalp. Now, allergic reactions could be potentially life-threatening. They come with rashes, but they have the potential to be bad. They were triaged and waited and waited and waited. And after a number of hours, they gave up waiting. And they went home with their itchy scalp, hoping that it would be okay. And it turned out to be okay. And I'm really glad for that person and their family that it wasn't a life-threatening allergic reaction, but it's in the pool of unknown. And so this choice of leaving is a test. It's almost a test of time, right? Will I get better? Will I not? To put a a harder lens on it, it's almost a Darwinian choice. You're making a choice that maybe I'll be okay. Some people are, some people aren't. And that is tragic that we forced them to wait so long. They made a choice, a hard choice, and they suffer consequences that we are completely unaware of as a system.
I suppose it is true, as the Alberta government says. I mean, this isn't a uniquely Alberta problem. ERs in other provinces face pressures too, but it doesn't absolve the government of responsibility to address what's going on here. So, as you say, it's a multifaceted problem, but what do we need, or where do we even begin here?
I think we need to start fighting with other provinces properly competing for resources by appropriately, funding at least the healthcare system. We need to stabilize our nurses by giving them proper salaries. Every few years, rip up the doctor's contract, fight with the nurses, offer them 1% in a setting of 30% inflation. What we are doing in the name of cost control is not what the healthcare system needs when it is already short, right? And those decisions were made decades ago. It takes a decade to train a physician to be a functioning physician in our system. It takes 4 years to train an RN. We keep trying to train people less, which isn't helpful. And certainly people who are faced with, less experienced healthcare workers may notice that. But we need to reverse some of these decisions. Those decisions 20 years ago mean that the pool is short. And so, yes, you might have to pay more than another province to attract the physicians here. You might need to form a stable relationship with the physicians or the nurses that doesn't involve this, well, my number says this, because then the nurses leave. The physicians have left. We're short, but it's across the country. So if everyone's short, what is Alberta going to do against those other provinces with looking at that to say we need to be better? This goes back to numbers. I've seen some very interesting use of numbers to make decisions and say, oh, well, we still pay the best in the country. That's manipulation of numbers. It's manipulation of people. And I think the fact that there's no one there to look after you for any queue in any part of our healthcare system says that it doesn't really jive. And that's the difference. I need a nursing home. There's a big wait. I need a joint replaced, a big wait. I need cancer care. There's a big wait. There's a big wait for every major thing in our system, essentially, including unplanned, unscheduled healthcare problems like the emergency department.
And the thing is, I mean, we see the longer wait times in the cities, but maybe that's a consequence of what's happening rurally, where we see closures and people are forced to go to the city to go to ER. So it's not just an urban or a rural, it's kind of across the board, isn't it?
It's across the board. It's everywhere. But imagine closing a rural site. That is horrific. That tells everyone in that area that you don't get anything. You are on your own until you can get to the bigger city. That's a wait time. If it's an hour drive to the big city, that's travel time is a wait. So that is another form of delay, right? Well, you've cut yourself with your kitchen knife and you're bleeding and your finger, you cut the tendon and you can't work your finger, just something simple. But now I got to drive an hour and a half to the city to wait another 6 hours in a department because I'm not dying, but I certainly need healthcare. So my hand is functional again. That's a simple example of a minor problem. We don't always have to talk life and death. That's where people want it to be dramatic. I'm having a heart attack. I'm dying. Well, if it's an hour for you to get to the hospital with a bad heart attack, you might just die. That happens all the time. But let's just say it's something I need. Cut the tendon in my finger. I can't work my hand. I can't work my job. I can't farm. I can't do what I'm doing in my rural setting. You need your finger. You need healthcare. It's unplanned. I didn't plan to cut myself. I need surgery. Unplanned, needs capacity. So this delay that the rural folks would find to drive to their city to then line up with all the city folk who are waiting as well is just an extra delay, right? So it's across the system. I have elderly parents. We might be looking at placing them in a nursing home. It's a long wait, could be years. When I see a patient with arthritis, whose knee, they can't walk on their knee hardly. I put a needle in the knee with a temporary injection. I say, you need to line up now. It could take you 2 years to get your knee replaced. Line up today for something 2 years from now. That's the type of wait times that we've considered acceptable. Cancer care. I've had a relative with cancer. I had to say, expect a 3-month wait for the cancer specialist to get to you. It's okay. I think it's a slow growing cancer. How does that feel? How does it feel as a human with inside knowledge of the weights in the system to tell my loved one, you're going to wait 3 months, but you're okay. I'm sure of it. I love you. You'll be okay. 3 months of anxiety. You've been told you have cancer. We're going to wait now. That's not how people want to be treated.
Well, no kidding. Well, we'll leave it there for now. Dr. Thirsk, appreciate your insight on all of this. And I guess we'll see where it all goes from here. But thanks for making some time for us here today.
I see that you're wrapping. I'd like to offer a reframe for everyone.
Yeah.
We framed healthcare as business, and business deals with numbers, and business deals with cuts and margins and things that aren't human. We need to reframe healthcare as a people problem. We need to reframe it as something where there's a person in that number, behind that number. And then we have to ask ourselves, what are we doing for the person, not the number? Let's talk about people.
Absolutely. Dr. Thirsk, thanks again.
Thank you.